All right, good evening, everyone. Want to call the Caldwell County Board of Health meeting to order this evening for June the 5th, 2025. And I'd like to welcome everyone who's in our audience this evening and those that are joining us by other mediums. So thank you again for being here. I don't think we have anybody signed up for public comment this evening, and so that'll move us to our invocation. I'll ask the Honorable Wayne Rash if he'll lead us in our invocation this evening. And Dr. McBurney, would you lead us in our Pledge of Allegiance?
Let's pray. Heavenly Father, we thank you for this day. God, we thank you for how good you are to us. And Lord, all that you do for us and provide for us. Lord, thank you for each person who's here tonight, God. Those employees of our county health department, we thank you for each of them and their dedication to their work. We thank you for each board member who's here and all those that work to put these meetings together. God, I thank you for their efforts and all that they do. And Lord, pray that you give us wisdom and direction tonight as we seek to make decisions and do that you would have us to do. And Lord, help us to be good stewards of county resources and Lord, most importantly, good servants for you. In this and in all that we do. And Lord, again, we thank you for who you are and what you do for us, and just pray that you go with us throughout the meeting and throughout the night. In your Son's name we pray. Amen.
Amen.
Salute, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you, everyone. That brings us to our announcements. Miss Anna Cook.
Okay. I did want to mention we had our public health lunch on May the 20th. Everybody had a great time celebrating public health, and we also recognized our Employee of the Year, Miss Francine Jimenez.
All right.
No other announcements.
No other announcements? Very well. Recognition of new employees.
Sure. So if I call your name, if you'll just stand so our board can see faces.
And you can see who we are.
So Miss Tamia Strayhorn, she's our health educator. Miss Haley Livingston, accounting specialist.
Yeah.
Mr. John Robert Boyd, environmental health. And Irina Orsace, environmental health.
All right. Well, it's nice to meet you folks, and thank you for coming on board in valuable roles, especially in environmental health. So, as he breaks for the door.
We are super excited, and everyone does a fantastic job. We are currently fully staffed, except for one vacancy in health education. Other than that, we are fully staffed.
Awesome. Okay, that's awesome. Very well. All right, so approval of our agenda amendments. Do we have any this evening to make?
Yeah, we can make one amendment to item 10C, and then take Dr. Picton off of that for a presentation, so.
All right. So with the recommendation of removing item 10C, any other agenda amendments? Hearing none, do I entertain a motion that we adopt this evening's agenda?
Motion to adopt the agenda.
Second.
And a second. Thank you. All in favor say aye. Aye. Any nays? No, good deal. All right. So the first item there is approval of the minutes from our February the 6th meeting. Trust you've had an opportunity to look those over. And do I hear a motion that we approve those this evening?
So moved.
And a second?
Second.
All in favor say aye.
Aye.
Aye. All right. So any, again, thank you. So that brings us to the approval of the financial reports, Ms. Brittany Raby. And the first item there is our fiscal year 24-25 update. So.
So you have a single piece of paper there that has the budget summary on it. I apologize, I forgot to put that in your packet. But we have we're at 83% of our budget, and we have expended 64% of our expenditures, and we're at the total revenue at 64%, and then county revenue at 65% there. So if you have any questions about any of that, I'm glad to answer what I can.
I think we're all good, as long as you tell us the state funding's still coming.
Still coming.
That's a good thing. All right. So any amendment or revisions that we need to make this evening?
No, there is, you'll see one there in your packet from May. That's one for food and lodging that you guys did vote for by email.
Yeah.
So that was just for food and lodging. Whenever they get their inspections done, we get back grant funding for that. So you've already approved that. I just want to kind of bring that back to your memory there. So that was for food and lodging. It was $8,101. So that'll give the opportunity for food and lodging to purchase some equipment that they need or anything food and lodging related. So that's based on their inspection rates.
Okay. All right, and I think we did have to approve that through email, so,
Yes.
all right. So anything else that you need to bring up in that?
No, sir.
So then next brings us to the budget approval for the submitted budget of 25-26. So you making that presentation?
I will, yeah.
All right.
So in your package, you'll find the proposed budget for fiscal year 25-26. Our ad hoc committee did meet on April the 15th to kind of go over that. We appreciate Dr. McBurney and Dr. Davis, who's not able to be here, but for their willingness to come and kind of go through that with us. So we'll just kind of go through that. You'll see there a letter from Anna that basically how we determine our fees. So we have a policy that's based on, and then we also use a Medicaid rate as well. So we do that at 2.5% or 2.5%, and then by the current Medicaid rate, and then of course our vaccines have a $25 admin price, and then of course those charges are adjusted with 340B drugs and things like that. So your budget message there. So this includes all of our departments, including all of our frozen and our vacancy positions. As Anna mentioned, we only have one vacant position as of right now. That's our health education position. And then our mileage reimbursement, we get that percentage from the county, and then we budget for that. And then our FICA retirement life insurance and all of our benefits, those are calculated by percentages that are given by our county finance department. We didn't have any capital outlays, and then of course workers' comp and unemployments are not included in our budget. And then there was, we had some of our state funds, there wasn't a huge reduction, but it was mainly in our WIC department with our caseloads and things like that, but that's statewide. So that was really the only thing that kind of went down in reduction there. So everything else is still kind of trucking along, so we're hoping that will continue to be the case. You can kind of see there our expenditures and then our revenue, and then as far as our county there on the message. So we'll kind of go in with each department if you guys would like. The first page you'll see there on the proposed budget is just a synopsis of all the departments and revenue. We did some readjusting, try to get it as close and decreased as we could. So I'm very thankful for our management team members that were willing to kind of crunch things and put their wants and all those aside and just focus on our needs. So we did have overall in our expenditures, we did decrease that by 5.51%. And then our revenue came up 1.3%, and then our county revenue came down 14.36% from county. So, and then total all revenues there came down just a tiny bit in the negative 6%. So county revenue came down significantly there. So. Next is our health admin department. Of course, you'll see that we had a negative 17.48 on our decrease in that budget. None of those line items changed, just for kind of kept the budget the same. We just kind of removed some money around in different line items and things like that. Our travel training did increase there, but that's because we did hire the new health educators, so that would allow them to have any trainings or anything that they would need to be certified. So you'll see that, that's what that 32% increase there was. But overall, of course, the salary and benefits, those came down due to people retiring and things like that. So that's what those decreases were. Any questions about admin? Same thing in environmental health. They had a decrease there. We did move out professional fees. We moved that money out into contractual, and that just to cover, because now they're paying the attorney fees out of contractual, so that would allow to cover those expenses. So no overall change, just moving line items around. And of course, those increases would be all salary and benefits from the percentages that we have. Any questions for environmental? Women's health stayed the same. Nothing changed with their, any of their expenditures except for their salary and benefits there. Again, people retiring, moving things around, stuff like that, so. If you have questions, just stop me, okay? Child health, the same thing, no changes there in their expenditure budget. All their changes was from salary and benefits. Dental would be the same. Dr. McDonald, she just kind of moved some things around in other line items. The only increase that you'll see there in the travel training line was that they've extended the day for the North Carolina Dental Association. They've extended that conference a day, and that allows her to receive all of her CEUs. So we had to kind of budget for her to be able to stay the whole entire time in order to maintain those CEUs. So that was the only change there. Oh, and there was an increase in the contractual line, the 15%. They're in the process of having to require radiation badges, so that would cover that cost in order for them to be able to have those badges that they need in order to do x-rays with. Clinic, same, the only changes there we had was in salary and benefits. Clinic's a pretty big section there, so it houses a lot of different grants and things like that, but we've maintained, so we're excited about that. And again, WIC would be our last department. Again, changes there just in salary and benefits. They did come down in their postage line as well as the mileage line. So their postage, they cut back because like I said, they had a decrease in funding, so we try to cut things back so that anything that they would send that wasn't necessary, I guess, so to say, like they were sending birthday cards to all their clients and things like that. So instead of mailing those, we're physically handing those to the patients as they come in. So we were able to kind of back off on the postage lines. And then their mileage as well, they don't get out very much, so we kind of cut that back out. You know, they're seeing all those kids, so they have to kind of stay in the office. So based on what they've spent, we kind of backed off on that that line item. And then they just move things around, their supplies and things like that. Still, budgets stay the same. They just kind of move things around in different line items. That's all I have for expenditures. Do you have any questions about expenses?
And I keep asking, I know, but we don't anticipate anything from the federal level impacting this budget in a cut? I mean,
Not at this time.
right?
What I'm hearing right now, of course, it was COVID, our COVID funds, but then also tobacco prevention funds, and we don't have any directly for tobacco.
Yeah.
We may have healthy communities or whatnot that we focus on certain things like tobacco, but no funding directly that's
Okay.
been cut.
All right.
The next piece you'll see there is just our revenue summary report. This does include all of our grant funds that we receive from the state. The only thing that is not included in this, in our WIC revenue there on the back page, is our breastfeeding peer counselor funds. We always get that AA late, so should be right around the same amount of funding, but that's not included in that. So we should be right on target with the WIC funds once we receive that AA. So that's the only thing that's not listed there.
All right. And that's what's been forwarded over to the commissioners for approval. And I'd like to thank the staff and the ad hoc committee for putting it all together, because I know it's pretty intensive to try to get all those numbers and everything figured out. So, but I do appreciate everybody working hard to do that. Good thing, I guess, that salaries are coming down in one sense, but bad thing because we got a lot of experience leaving.
Right.
And we're having to refill that with not so experienced folks, not meaning they're not going to be good, but sometimes experience has a lot to, comes into play with,
Right.
with certain things, so. But we do appreciate all of that and the retirements, and hope people get to enjoy retirement in this world that we're in. So do we need to have an approval on that?
Yes, sir.
So having the presentation made, and of course it's coming out of committee with ad hoc, budget ad hoc committee, what's the pleasure of the board this evening in adopting this budget for 25-26?
I'll move to approve.
All right, and do I have a second?
A second.
I have a second, thank you. And any other discussion or comment? One question I did come to mind, Brittany, and I'm sure you have, but we allowed for merit raises to be in this budget as well. I assume.
Up until July, and then we got from Tony that we would not include those in there, so they've not been included.
Okay,
Yeah.
so we'd have to come back and do an amendment to allow
they-
that to be,
Yeah.
They do.
well, there'll be merit raises.
Well,
Yeah.
anything for the next year's merit will come out of that merit pool that's in the
Right.
budget.
Yeah,
so,
I believe it's a different
Yeah,
area
it's
than
a different-
ours,
yeah.
so we shouldn't have
Yeah.
to.
okay. Good deal. All right, so all of that being said, all those that approve, say aye. Aye. Any opposed? That motion carries. And then next would be the adoption of the 25-26 fee schedule.
Yes, so we have our dental fees as well as our clinic fees and then our environmental health fees. You'll see that there in your packets. We had no changes there except for our, Anna, you kind of helped me with this, the septic permits, is that correct, that went up?
Right.
And then our dental fees, all of that, of course, is based on the Medicaid rates. We kind of, this goes back to the 2.5 that we multiply to receive back from Medicaid as far as setting our fees. And then also with our clinic fees, that's also listed in there. You guys, I sent an email out to vote. We're in the transition period for Athena. So since they're kind of taking over our billing, we're getting different fees to kind of add to our fee schedule every day. So you guys have voted to add those as they come in. So luckily, I haven't had any of that since this has been since you guys have the packet. So what I have is listed there. Of course, we didn't, just some wording change as far as what Dr. Picton recommended with the words and stuff on there. So that would be the only change that we have as far as fees, other than the Medicaid rate change.
And I will mention on environmental health, I can't remember exactly how much it went up, maybe 50 or so,
Yeah, I think it's 25 or 50, I guess.
but we are still lowest than our surrounding counties. We wanted to increase, but still be comparable, if not less, than surrounding counties.
All right. You might have any questions about the fee schedule? And if not, do I hear a motion that we approve the schedule as has been presented?
So moved.
I have a second.
Second.
All right. Any other discussion or questions? I do know, and I want to say this, and Anna and I have had some conversation around the environmental health, specifically around septic tank. And we're going to be looking at that a little more in depth as a service that we're providing for the county and for folks. I mean, I understand the challenges that we have in trying to get out there and meet the needs and do the site visits and all of those things, but also don't want it to turn into a burden for our residents. So it's just one of those things, and would challenge if anybody knows it of anything else we need to address in that light, let us know, because we do want to be competitive with other counties and folks that are trying to build, and then I want to be good neighbors, if you will, to the people that are wanting to stay here and build a home here and be here. So we don't want to get the fees so expensive they don't feel like they can afford to do that. So just wanted to make that comment. All right, so having a motion and a second to adopt the fees, all in favor say aye. Aye. Any opposed? And that motion carries as well. So thank you again for putting all that together. That moves us into our public health updates and child health safety fair. Ms. Strayhorn? No? Yeah?
Yeah.
One of our new employees. Thank you again for coming to work for Caldwell County.
Of course, happy to be here. All right. So again, my name is Tamia Strayhorn. I serve as a public health educator, also as a Safe Kids coordinator for the health department. And today I'll be talking to you a little bit about the Child Health and Safety Fair. So the Child Health and Safety Fair this year hosted at the health department in April, and our theme was game night. So all of our participating vendors were able to pick a game theme that they wanted to do. All right, so what exactly is the Child Health and Safety Fair? So it is a critical, oh, do I need to wait for the presentation? Whoops. Okay, are we good? Move forward, okay. We'll start from the top.
You may have to hit the arrows.
The arrow, okay. Then move forward.
Yes, there you go.
We learn by doing. Okay. That was a practice run. Okay, so again, my name is Tamir Strayhorn. I'm the health educator at the public health department. So I'll be talking to you about the Child Health and Safety Fair today. Okay. So the Health and Safety Fair, we hosted it in April of this year. We had the theme of game night. So a lot of our participating vendors were able to participate by picking a game that they were looking to kind of theme their safety information around. Okay, so what exactly is the Child Health and Safety Fair? So in a nutshell, it is a critical platform for educating our families on health and safety issues, and we're able to do this through educational and interactive booths and workshops. And our kids in the community, they love it. They love it. And we have Restart that is pictured and some other community partners that were able to participate with us this year. So sponsorships, AmeriHealth was able to sponsor us by providing $1,000 for this event, and we are definitely thankful for that. And these funds were utilized for participant and vendor refreshment. So for our participants, we were able to purchase the first, Kona Ice for our first 200 participants that came through. And for our vendors, we were able to purchase pizza and refreshments. So we had 31 vendors total participate with us. And then we had a little under 200, so 199 participants with us. So that's awesome. We're able to reach a large number of the community. And again, we got a lot of engagement. We were able to get our information out there, which is what we want. Okay, and the vendors that were able to participate, it was cross-sectional. So we had safety information represented from public safety, social services, healthcare. I know strictly from the health department, WIC was there, DSS, health promotion, Safe Kids, I was there. And then impact on families, we're able to connect everyone. We all have the same goal, but we're able to connect together and get our information out there. Okay. All right. And I will shift it over to Jordan so he can present on our thoughts report.
y'all have any questions before we transition over?
No.
No? All right. Good to see y'all again. How y'all doing?
Doing good.
Good. So my name is Jordan Jeffries James. I'm a health educator here along with Tamia. I'm also the wellness coordinator for the county employees. So today I'm going to present for you the State of the County Health Report for 2024. This report is put out roughly about every 3 years, and essentially it's a snapshot of how we look as far as the health and wellness of our county and how we've progressed from the last SOCH. So we're going to give you, in a nutshell, version of what the SOCH told us for 2024. And so for our top priorities, we listed transportation, substance abuse and misuse, and mental health as our top 3 priorities that we were focusing on, and that we saw was of a huge need in our SOCH report. So starting with transportation, we created a transportation collaborative. It's a coalition of local leaders and directors addressing Caldwell County's transportation challenges. The focus of this group was inclusive representation, data-driven decision-making, community engagement. And the strategies that they employed or suggested were to expand bike lanes, boost public transit access, promote electric vehicles, partner with experts and regional agencies, as well as measure the impact and drive awareness. Another one of the target issues that we saw within our SOCH was substance misuse and abuse. And so some of the things that we employed within the health promotion department specifically was the Catch My Breath program, which was implemented within the Caldwell County high schools. And it's a health-focused education program on vaping. So essentially, we were trying to give the youth allow them to make an educated decision. So that was the main idea behind that program. Not to necessarily scare them into making changes, but to let them know that this is what could happen and might happen if you continue along this path, right? So a big part of that was just kind of meeting them where they were, understanding their thought process on why they were vaping, whether it was a mental kind of thing where they felt like it was helping them to deal with a lot of things that are going on when you're, in high school, when you're young, whether it's a peer pressure thing, whether they're just doing it because it looks cool, but kind of understanding like where they're coming from and also let them know what the effects could be. Oops, hold on now. Can't quite see. There we go. Currents. There we go. All right, sorry about that. But meeting them where they are and making sure that they understand like what the consequences could be. And with this program, the kids that we met were kids that were caught vaping within the school, on the school property, and they were required to attend this program as kind of their, not necessarily punishment, but to educate them on the program and how that could affect them. The goal was, again, to reduce teen vaping through informed decisions. So we really just let them know what could happen. Another program that we did within health promotion was the Lock Your Meds program. It was educating both parents and guardians about proper storage of their medicines. So we know that that could be a big issue, especially among teens with substance abuse. And so letting parents and guardians know that this could be an issue within your household. You may not know and you may not understand, I guess, the impacts of it, but just educating them on that and how to make sure their medicine is safe and locked up so their youth are not, allowing them access to those medicines. Another program that we put together really it's a coalition, was the Hope for Caldwell coalition, which is essentially made up of a variety of different community members and actors. And we have this year put together our first annual fentanyl awareness challenge. And so you can see on the screen 3 of our winners from that challenge. On the top right, we have Jacorian Logan. He was our first place winner. On your bottom left, we have Darissa Horton, second place. And then on the bottom right, we have Gavin Keys, who came in 3rd place. And with that challenge, we asked the youth to come up with an idea on how they would address fentanyl awareness. So the bulk of the challenge was just to get an idea from the youth, have them think about what could effectively make change in their community, how they would go about it, and if they had the resources to do that, how would it look for them? And so they each came up with 3 different projects. Our winner, Jacorian Logan, his project was actually a podcast, which was really cool. And I want to highlight him because he was one of the one of the participants that actually took that step further, besides just creating a project, he acted on it. So he told about his personal story and how fentanyl affected his family. I'm not going to go into too much detail, but he talked about the personal impact it had on him, right, and how that impacted his family and the people that were involved. It was very heartfelt, very, very close to the heart. So I really want to highlight him, and it was a great project for him. And the video is on YouTube, if you can find it. I'm not sure exactly the name of it, but he actually posted it, so you can view that as well. And then through I'm not sure if it's on not on the next slide, but we got a grant, a donation from Via Health of $1,500 that was put towards purchasing prizes for each one of these participants, as well as allowing us to kind of celebrate them once we finish the project. And on the next slide, I'm gonna show you a quick video, if I have a sec, of, hopefully you can hear it.
My name is Teresa Bray.
So my name is Jacorin Logan.
And I participated in this to help spread the awareness to all these against people.
And I participated in this challenge because it was a big impact in our community. And you see a lot of the effects in school, and I wanted to help in any way possible.
And I decided to participate in this challenge because I want to give myself the opportunity to speak out about fentanyl awareness, about drug abuse and the epidemic in Caldwell County.
I encourage you to participate in the future to help our community. I'm sure the community helped you, so this is just like a building block to help us in the future to grow.
This challenge is a really great cause, and they really are trying to make a change. And I think the more people that help, the bigger the impact it will make.
Honestly, it meant the world for me. I could get my story out to more people. I could educate, even if it was just the coalition and the judges in the room or youth that may hear my presentation. It means a lot to be able to get that out there and talk to everybody. I would definitely do it. It's a great way to meet new people. It's a great way to give yourself a challenge, to learn a little bit more about the world that you live in and the problems that we face every day. So it's an amazing opportunity, and I'm very glad that I did it.
And so we're in the process of kind of highlighting their accomplishments and getting that out to the community so we can promote for the next year's challenge. All right, so the next thing that we're going to talk about is mental health, another one of our emerging issues that we saw within our research report. So with that, make sure I get on the right page. All right. So they created a crisis response collaboration, and they used a sequential intercept model to kind of come up with an idea to address some of the mental health issues we were having. And so really, we're trying to create an alternate route for a lot of people who are dealing with mental health or substance abuse issues and stuff like that. So at Intercept 0 and 1, we want to focus on community service and law enforcement. So essentially, at Intercept 0 and 1, the focus is on crisis intervention with services like mobile crisis management, behavioral health crisis lines, and emergency housing. At Intercepts 2 and 3, we want to cover the initial detention and court hearings, offering intake screenings and emphasizing the need for more behavioral health supports within the jails. At Intercept 4 and 5, we want to focus on reentry and community corrections. There is a push to expand peer support and develop recovery housing to assist individuals with transitioning back into the community. So that's what that model came up with. And it also identified some gaps that we were seeing within our society. One is staffing shortages across services. We're also seeing limited medication-assisted treatment access in jails, inadequate transportation for rural populations. We already talked about how transportation is an issue within our county. And then poor data sharing between justice and health systems. So that's what they have found within that. And also, the priorities that we listed for change were to expand peer support programs, develop recovery housing, establish behavioral health urgent care, launch a dedicated recovery court, and then the strategic actions that are currently underway are to improve interagency coordination, enhance the MAT access in detention centers, and then strengthen data integration and behavioral health resources. And so just continuing on some of the, get more detail into the emerging issues we saw. So we saw high rates of injury and deaths, increase in drug overdose deaths, high teen birth rates, high rates of adult smoking, obesity and physical activity is increased, and then limited access to mental health care. And so just to give you a little bit of a breakdown, so with the injury deaths, we saw higher rates than higher rates than the state and national average, which suggests there could be suggests rising accidents and or violence. And one way that we could address this is a need to expand injury prevention, education, and safety programs within the community. With drug overdose, we saw significantly higher than state average and national average with those numbers, which is indicating a crisis level burden within our county. And one way to address that is to increase treatment access and then also increase the harm reduction and awareness as well. And then with teen birth rates, we also saw a higher than state average and national average with that. And then that can indicate long-term risk within mothers and infants, especially young mothers and infants. And then one thing that that we can do to kind of address that is to increase our sexual education classes, including family planning, and then increase our teen support that we have within the county as well. And we've done a little bit of that this year with some different community partners. For example, we brought some teen parents in to learn about what our health department could offer them between WIC, maternal services, health promotion. So a variety of, I guess, things that we can offer within our health department. So some other emerging issues, again, are adult smoking. Smoking rates have remained well above average. It's been a consistent thing. That can cause an increase, obviously, in lung disease as well as heart disease. So one way to address that is to increase the amount of smoking cessation programs that are available and access to those. Increase public campaigns to get awareness out on the effects of smoking. And then, of course, policy enforcement. Obesity and inactivity is also raising as well, which leads to diabetes and a bunch of other health issues that we know about. So ways to address that: promote fitness and nutrition and healthy food access, increasing access to healthy food, And then lastly, mental health access. So there's a severe shortage of providers for that, and limits in care can increase risk of anxiety, depression, and addiction. So it has an effect on both mental health and substance abuse. So a way to address that would be obviously to grow our provider network, expand telehealth, and then integrate care. And so the last few things, so access to care, just to give you some numbers. I didn't want to highlight every set of stats that we had on our SOTS report, but these are the kind of things that stuck out to me. With the access to mental health care, we saw the ratio was 910 to one provider. So it's 910 residents within our community to one provider for mental health. And for comparison, with North Carolina and the state is 320 to 1. So you can see that we're about 3 times the rate of the state and national average. So there is a need for more providers for mental health care. And why that matters is that can increase risk of mental illnesses, ER visits, issues within our justice system, and then, of course, poor life outcomes. Another one to highlight is our drug overdose rates. So we are at 38 per 100,000 individuals, which is higher than, again, the North Carolina average, and also higher than the U.S. average as well. And this indicates an active substance abuse crisis, likely driven by opioids and fentanyl. And it also shows that there could be a high mortality rate and community trauma that can be involved with this as well. So this is showing that this is another big issue within our community. And then lastly, the teen birth rate, which is at 25 per 1,000 females versus 18 for NC and 17 for the U.S. So again, all of these averages are higher than the state and national average, which is showing that these are issues that we really need to address within our community. And we have been taking steps within health promotions to address these. So with that being said, do you have any questions or concerns? Anything that I might be able to answer for y'all? I know that was a little bit lengthy, but just wanted to give y'all a snapshot of what we have going on within our county.
We appreciate the report and all the effort that you put into that. I know that there's quite a bit that goes into it, but it does give us a good snapshot of where we are in our county, and certainly brings to light there's issues, and how to address those is part of the issue too. So, as an example, I guess, how do we get more mental health providers in Caldwell County? we've tried everything we know to do, and so we just need to figure that one out, I guess, because
Yeah.
that's a big one is,
Definitely easier said than done.
yeah. So I do know that is the, what's it called, the one that's walk-in, like an urgent care for mental health. Yeah. Is it up and running now? And
It is.
yeah, so that's huge. So, okay. Anybody else got anything or any questions?
I do want to thank Jordan and the team for doing this. This is a huge report compared to our every 3 years for community health assessment. So we have to do one of the SOTs every year that the community health assessment is not due. So thank you, and I appreciate it.
Yes,
No worries.
we appreciate it.
Well, y'all know where to find me. Y'all take care. Thank you.
Thank you. And next is our communicable disease mid-year report, Mr. Chad Barr. Welcome, Chad.
Thank you. I'd like to start out by just saying, thank Jordan and Health Promotion and Health Education and our health director for their efforts in the State of the County Health Report. Because, transportation, substance use disorder, mental health just goes hand in hand with communicable disease and the spread of communicable disease within our county. So I commend them for their efforts in that. So I will be just providing a very brief, no PowerPoint, Mr. Chairman, talk about the kind of the state of our county as it pertains to communicable disease and tuberculosis. So mid-year review, respiratory illnesses, of course, have specifically influenza, COVID, and RSV have all decreased back to their baseline. There was one influenza-related death in an adult male in February of 2025. There have been no COVID-related deaths, fortunately, I'm thankful to say, since February of 2024. And then there are currently no reported COVID-related outbreaks in the county at this time. Vaccine preventable disease. In early March of this year, we were notified about two siblings that were attending a daycare in Caldwell County that were both diagnosed with pertussis. Neither of these were vaccinated, and immediate public health measures were taken to begin to kind of identify contacts, check immunization status, and to make sure that we could prevent an outbreak of whooping cough or pertussis within that daycare. Fortunately, we did prospective surveillance was conducted for 42 days, which is twice the incubation period, and there were no additional positives at that facility. Also in March, an unrelated diagnosed pertussis in a group home in Caldwell County occurred. Again, that investigation was launched, surveillance, and one additional case was identified, but that's all after 42 days of incubation and surveillance. So our health director is not here to talk about measles tonight, but I did want to just touch briefly on measles just to give you an update. So the health department has been involved in two measles investigations right here in Caldwell County. Obviously, both of those ended up as negative. But what's important to know is the health director, the medical director, and other administrative staff, in collaboration with partnerships with Dr. Sarah Young at UNC Caldwell, we've all discussed our methods and responsibilities. And we want the Board of Health to know that we're prepared to identify, to appropriately test, provide immunizations, and use control measures to prevent a measles outbreak in the county if that should occur. So fortunately, no measles cases or anything like that. As far as STDs, chlamydia and gonorrhea infection rates remain steady with a slight decrease in syphilis cases. There have been no congenital cases identified since October of 2024. In that month, we had 2. And then unfortunately, there have been 2 newly diagnosed HIV cases since January 1st of this year. Both of those were associated, again, with the substance use disorder. Hepatitis C continues to be our most commonly reported and diagnosed bloodborne pathogen, is most commonly associated with substance use disorder, and foodborne and vector-borne illnesses have steadily increased since March of this year, but they still remain within 20% parameter of our previous seasons. So we'll continue surveillance and certainly notify the health director of any variances or concerns, and you'll receive an end-of-the-year update in November.
All right. Any questions for Chad? Well, thank you again
Thank
for
you.
all you do, Chad, and
Thank you.
keeping us safe and informed of these things that are happening in our community. So, but we do appreciate our staff at the Health Department who meets that need and gets the public educated and helps to keep it from getting to be something bigger than just one or two. So we certainly appreciate that. Next is approval of our Board of Health operating procedures, and our Health Director, Miss Anna Cook's going to review that with us just a moment.
Sure, so in your packet, you should have the operating procedures. This has not changed from last year. You can read through, however, there are no changes. We just need to do a vote.
All right, so that, I guess that goes along with every year we have to look at those and adopt them to maintain our certifications. So anybody have any comments there? And not hearing any, do I hear a motion that we approve the operating procedures for this coming year?
Motion, we approve the operating procedures as presented.
A second?
Second.
All right, and any other discussion? I'll call the question. All in favor say aye. Aye. Any opposed? That motion carries unanimously. And that brings us, I think, to the end of our meeting. I will inform our board, we did, Mr. Rash and I accomplished our year review of our health director, and so that all of that went well, and we did receive several of the evaluation forms back, and we met with Anna and had a very productive meeting, and everything went well, and we recommended her for the Merit 2. And so I just wanted to make sure everybody was aware of that and the outstanding job that she continues to do for our health department and for the residents of Caldwell County. So
Thank you.
we thank you for all of that.
Yeah,
Thank you.
Thank you.
Anybody else got anything? I'll entertain a motion to adjourn.
So moved.
A second. All in favor, say aye.
Aye.
Aye. Thank you again for being here this evening, and thank you for joining us by meeting.